Receiving a magnet designation is a wonderful recognition that the work that we do every day matters.
Sometimes when we ask, what is it to be a magnet nurse? I feel like, it's really synonymous to asking, what is it to be a Stanford nurse?
When an organization, I think, really values and listens to the people that are on the front lines, that are the ones that are really engaged in the work that's being done on the day-to-day, that's really your only way to true excellence.
When I first came to work here, I was just blown away by the level of expertise and just how dialed in everybody is to advancing nursing. There's not a single person working on the floor that I wouldn't trust my own personal family members with. You can just feel it when you walk in to work in the morning.
This is the first magnet hospital I've worked for. It's different. There's the expectation that the nurses are held to a higher standard, that they're held to a higher education level. It's one of those things that fills you with pride. You're really excited about working at a place that values you and your voice.
It means that I work and can collaborate with professionals who are going to support me, colleagues who have the same vision that I do, and knowing that I have support and I can turn to somebody. If I ever have any questions or any issues, I know I have somebody who has my back.
It's pushed me to the best and hoping that I can make an impact not just people's physical health but also mental health. It's really give the nurses a platform to showcase what they have done and what that has making an impact on the patient. I'm proud to be the Stanford nurse. I'm proud to be able to provide the best care to our patient.
The Magnet Institution gives you the resources, the support that you need. I truly believe that is throughout the hospital. That starts at the patient.
We know across the country there's only about 9 or 10% of organizations that are magnet designated, but there's only 2% that have been 4-time designated. And each time the outcomes are more significant in terms of your ability to achieve them, and so we at Stanford have to continue to raise the bar.
We know that it gets harder each time we go through it. It stimulates us to want to do the work because I think we feel like we really are the best and always want to be the best.
The patients at a magnet institution gets the best care. But here at Stanford, going for our 4th designation, they get 4 times the rounds of the best care because they know that we've been doing this for a long time.
I know that being at a magnet institution, that it really affords you the opportunity to be your authentic and unique self. What we want to do here at Stanford is to be an innovator and to be a leader in care and care discovery. And so I think working at a magnet institution really affords me that opportunity and that ability to grow and develop in myself and to grow and develop others.
Overall, a good nurse has to have a foundation of caring and compassion, and then they can just build on that, bring their own characteristics in, their own skill set, whatever they're good at.
What makes a great nurse is heart. I definitely would not do it if I didn't feel in my heart that it was something I was called to do and something that I am called to help. We have a determination, and it's based off of resiliency. Magnet nurses are resilient people.
There's a spirit and enthusiasm that you can feel when you come into Stanford Healthcare, a pride that nursing brings to the organization, and a recognition for the contributions that we make to this health system. And I would just like to say to each and every staff nurse in this organization and our nurse leaders and other care providers at Stanford Healthcare, a heartfelt thank you. You made a difference and your excellence is noted.